first off, could you just kind of give us a little bit of your own background in oncology?
Sure. My name is Christoph. I'm a professor of radiology in the section of breast imaging here at the University of Washington. Also an adjunct assistant professor in health services and policy research at the University of Washington School of Public Health. I currently direct the Northwest Screening and Cancer Outcomes Research Enterprise, or Northwest SCORE, which is a partnership between University of Washington Medicine and regional health systems and providers to gather the data needed to inform screening policies and practices.
Great. So looking at breast imaging, can you speak about some of the latest advancements in breast imaging?
Sure. I think the major advance that is on everyone's mind is artificial intelligence and AI. Multiple commercial products are now available and FDA approved for use as an adjunct tool for radiologists interpreting mammograms, both 2D and 3D mammograms. What these are meant to do are to improve both the performance for radiologists and the outcomes that are experienced by women. A lot of these algorithms are based on training from hundreds and thousands of exams with deep learning technologies that can improve over time.
So how have these new advancements improved patient care?
So we're really in the early stages of adoption, where several have garnered FDA approval based on reader studies. What we are trying to do now is actually validate them in screening populations. So here at the University of Washington, what we're doing is taking our available screening data and images from years past and taking the commercially available algorithms and other algorithms that are in development to test them and externally validate them in our populations to see if they will improve outcomes over time. While the promise is there, the evidence still needs to grow.
So as breast imaging continues to improve, what sort of other research is currently ongoing that you think is worth noting?
I think there's a lot of research focused on personalizing the screening approach and paradigm. For instance, women with increased risks of breast cancer may benefit from supplemental screening technologies. We're trying to make these technologies more user-friendly, more accessible, and more affordable. So one of the newer supplemental screening technologies is what we call abbreviated or fast MRI. These are MRI scans that can be done within minutes and really rival the amount of time that it takes to do, say, a screening ultrasound. Yet abbreviated MRI could have very high sensitivity and detect cancers earlier.
So bouncing off of that last question, where do you see breast imagery research moving in the coming years?
I think what we're going to see is a rapid development of new technologies and a movement towards adopting artificial intelligence technologies. These technologies can not only help us detect cancers earlier, but they can help the radiologists in terms of their clinical workflow. Some of these algorithms can be so good at teasing out the negative screening exams that those exams may no longer need radiologist interpretation. So it actually could improve our workflow and address work shortage issues we have in terms of the number of radiologists out there that can interpret mammograms at an expert level.
So I know that you touched on this a bit, but looking at artificial intelligence, can you elaborate more on how artificial intelligence is being used to enhance breast cancer screening?
Sure. So there are a number of ways. I think the most likely first use is as the second reader. So an artificial intelligence algorithm could interpret a mammogram and basically help decide whether a woman should be recalled for additional imaging or not. What we found with the Digital Mammography Dream Challenge, which was the largest crowdsourced challenge for AI algorithms and mammography, was that no individual algorithm could outperform a human radiologist, but in combination with another radiologist as a second reader could improve overall performance. So what we're likely to see are some early adoption in community settings of these AI algorithms that could serve as a second reader to radiologists and hopefully decrease false positives and increase cancer detection. There are other uses though for artificial intelligence. I mentioned the triaging of negative exams. There are other algorithms that are meant to predict future cancers. So not just detect the cancers on the image itself at the time of screening, but to provide a risk prediction score for women. And that type of risk prediction score, just based on the imaging features of a mammogram, can help inform a woman about how frequently she should get screened and if she might benefit from supplemental screening technologies.
Great. So for patients, how or what would be your greatest piece of advice with regard to breast imagery?
I think my biggest piece of advice is that every woman should know about their own individual risk factors. We know that we now have state reporting laws that require radiology practices to inform women about their breast density. That's going to be part of national legislation with an amendment to the Mammography Quality Standards Act. But in addition to their breast density, there are other major risk factors such as family history, prior breast biopsies, and these factors could accumulate such that a woman is at higher increased risk for developing breast cancer. It's important for women to know their individual risk factors, use available risk calculators, and talk to their primary care providers about whether or not supplemental screening makes sense for them.
So that's all I have for you. Is there anything that I didn't ask that you think is worth mentioning in this space?
Just in terms of, in light of the pandemic, I just want to mention that the Seattle Cancer Care Alliance and University of Washington are really making a push to encourage women not to forgo their screening. What we've experienced over the last several months is that tens of millions of women may have delayed or even put off their screening for the entire year. We want to communicate that we're doing what we can to make the environment safe, take the precautions, and to increase our capacity with extended work hours to allow women to come and get their screening to prevent delayed diagnosis of breast cancer.
Absolutely. Well, thank you so much for taking the time to speak with me. I really do appreciate it.
No problem, Hannah. Thank you.